waiting room. So we'll let everybody get in and get settled, and we'll start here in just a few seconds. All right. Well, good day. I'm Jill Holt with Mountain Pacific. And today we are bringing, we have a real treat in store for you. We have a guest speaker and a team actually to support our guest speaker. Today we'll be talking with BASE10. They are an infection prevention and control, your on-demand infectious disease expert. Next slide, please. So just a few housekeeping items to remember. If you would at any point think about any webinar topics or clinician ideas that you would like to see us cover during our weekly presentation, feel free to enter that into the chat box as we go. We'll be continuing with this presentation each Wednesday at this time. Next slide, please, Mary. So we have a polling question. How comfortable do you feel addressing patient concerns about the COVID-19 vaccine? Very comfortable, somewhat comfortable, somewhat uncomfortable, or very uncomfortable? We appreciate you participating in these polls. This does inform our work. It just helps us to navigate how we can better support you. So thank you for taking time. Okay, I think we've got everything we need there. So here are the results. So most everybody on the call today feels somewhat comfortable. I think that's fair to say. And probably equally, we have folks who are between very comfortable and comfortable, and then a few who are very uncomfortable, and one person very uncomfortable, and somebody who's somewhat uncomfortable. So thank you. All right, should we move to the next slide, Mary? And can you drop the polling results?
That's on your end. You just
that's on me. Okay, well, thanks. Well, just a quick little disclaimer, because we have the privilege of hearing from Dr. Fang and his team, we did consent to going over just a few minutes. So this presentation will be about 40 minutes. We certainly understand if you need to drop off at the top of the hour at 3 o'clock Mountain Time. We won't be offended. We understand these things happen, and sometimes you need to get on with other things throughout your day. But if you can stay on, I think you'll find it valuable. So with that, I'd like to introduce Dr. Michael Fang and his team. They're from BASE10. Dr. Fang is a geriatrician who completed his medical training at Northwestern University and his geriatric fellowship at the Medical College of Wisconsin. While practicing, he also served as the Director of Informatics for Indiana University Health Systems, and later created a population health analytics platform that is servicing 7 million mental health patients. His team at BASE10 has created an infection prevention and control solution that provides elbow-side, real-time clinical pathway recommendations to guide nurses and physicians that is scalable across nursing home facilities. So Dr. Fang, it's our pleasure to introduce you, and the virtual floor is yours.
Thank you very much, and good afternoon or day, everybody. If I can please have Mary advance the next slide for me. So we're going to obviously talk about infection because that is still very much a part of what we have to do in the nursing homes. And on this part, we all know this, right? There's always an infection triple threat that affects our facilities. We have staffing inconsistencies, which means that we are either losing intellectual capital of people who know how to do something, but they are leaving, or there's just not enough people around, which increases operational strain. And that, of course, means that there's usually deficiencies, and that's why there's a lot of nursing homes get cited every year by CMS. We do spend a lot of money too, unfortunately, on antibiotics, sometimes appropriately, or at least with good intent. But despite us spending a lot of money on medications, like 10%, of our medication spend is usually on antibiotics, it doesn't really lead to better outcomes, right? So the hospital admissions or readmissions are still massive, at least about 200,000, often more than that per year from the SNFs. And that, of course, means that there's lost bed day revenue opportunities and threats of FTAG. So we're always under these three triple threats. Next slide, please. And this is kind of what we know. It's because it's a very fragmented process, right? So when we have fragmented process, what you end up relying on is human beings to connect that process. And of course, if you're relying on human beings, then you got the problems of relying on human beings, which is, well, you don't have enough human beings necessary to provide a 24/7, 365 days a year type of model that is scalable or sustainable. The other problem that you have with human beings is that you're definitely then prone to human type of errors, right? So we could forget things, we could have our bias, we could have our behaviors, which affects the ability for you to standardize infection control processes or recommendations. And this happens across what we call these 5 big pillars of infection control at scale. So population surveillance, clinical decision support and tracking for the nurses and doctors, communication, of course, and regulatory reporting is something that we all have to do these days. And of course, as an enterprise, with those of you who are part of many facilities as an operator, those information have to bubble up to the top for the leaders to be able to work on, right? And sometimes that isn't clear either. Next slide, please. So what we've done at BASE10 is that we connected all these processes into one platform so that we can bring all data into one place. And that allows you the foundation to then create many, many things, including automation, including real-time reporting. It allows you to have, and I won't read off for the sake of time, won't read off what you can see on the slides, but it allows you for each one of these areas to create the type of coverage that you need that isn't always reliant on the presence of human labor, or even even if you did have those human labor, be potentially at the bias of the human being. And these are some of the benefits that we have provided with our platform. Next slide, please. And this isn't something that we just talked about. So as a company, we've actually helped a lot of nursing homes in the last year and a half. We're in about 140 nursing homes. We do a lot of assessments. About 40,000 possible infections are assessed by our platforms per month. And about 17 million data points are submitted at any given time to different state or government regulatory reporting bodies on behalf of nursing homes. We do reporting for all of our nursing home clients. That's something that Matt, when we get to that part of the presentation, we'll talk a little bit more about. And our clients have been able to benefit from this. They, on average, save about $1 million to $2 million for every 10 nursing home facilities that's on our platform. I say that because we have some clients that have multiple facilities again. So when we went back and look and see how much we've been able to help them with hospital days prevention or minimizing testing or medication related type of expenditures, on average, they usually are able to save about $1 million to $2 million per 10 facilities. Time spent, this is where we really make a difference, right? We know there isn't more human bodies to be had. So how can we make the ones who we do have more efficient, or perhaps better, not have to deal with a particular task at all? And this is where our clients really benefited from our automation. So one of the success stories I like to share is that we were with a nursing home client where they had about 35, a team of 35 providers, and that were doing infection management for a number of facilities across 10 different states. After our platform was installed in those facilities, about 2-3 months later, it was down to just 3 providers, just 3 people managing the same cases evaluated and treated. And they actually had fantastic outcomes where they're, specifically when it came to COVID, they had about 50% less mortality than the rest of their, colleagues in the same states. The other thing that we do, and again, we'll talk about this later, because all the data has been brought together and there's all this visibility behind what's being done, who it was done to, at what time. We bring all that information together into one place so that we can automate the reporting to the state and NHSN for our clients. And we're very proud to say that all of our 140 nursing homes who have been on our platform has had zero citations in the last 12 months. So we know this works, and we're excited to show you a little bit of what the platform does and how we can also support on the reporting and regulatory side. So next slide, please. And with that, I'm going to turn the screen over to Allison Foy. Allison is a member of our product team, but her background, she's a nurse practitioner. So having a clinical background and helping us design this platform to fit the needs of our colleagues at the forefront. So I think we might need to unshare and then allow Allison the ability to share her screen. Thank you so much.
Okay, good afternoon, everybody. Can you hear me okay?
Yes, we can hear you fine.
Okay, perfect. So good afternoon, everyone, and thank you very much for giving us the opportunity to present this demo of our infectious disease management clinical decision support solution for you today. This demo is going to cover a suspected UTI, but our platform also covers respiratory infectious diseases like COVID as well. So before I begin, I do want to point out that I'll be demonstrating our full integration with point-click care in a sandbox environment with no PHI. So some of you may be using point-click care at your facilities, and if so, that's perfect because we're very well integrated with them. But for those of you who use other EHRs at your facilities, we do partner with other EHR vendors, and our platform can be integrated with those as well. So to start off this demo, I'm logged in as a nurse, and I have just done an assessment of my patient who has some symptoms that are suspicious for a UTI. So I've already documented a current set of vitals. So the patient does have a little bit of a fever and also is experiencing some pain with urination. I've also updated my allergies, and I've started a note here. So I'm going to go ahead and complete my documentation of my assessment. So I can do this assessment in PCC as I normally would, or in the EHR as I normally would. So here you can see that I have documented the patient's symptoms. And as nurses, we sometimes document symptoms in the patient's own language, or we might use slang or not formal medical terminology to document our findings. So the exciting thing about our platform is that we've built in a natural language processor so that it parses out the relevant clinical information from this note in real time, including the patient's symptoms. So our NLP is far more than a keyword search because it accounts for the different verbiage and variations that clinicians might use to document the patient's clinical signs and symptoms. So we can basically parse out this hurts to pee symptom, and we can basically map that to dysuria in our system. So that's one of the very exciting components of our solution. So when my documentation is all complete, I can go ahead and sign my note. And what's going to happen as soon as I sign this is that it's going to basically pass those symptoms that were documented into our clinical decision support algorithm to determine whether or not this patient meets the requirements for a possible infection. And now looking at this demo, you may be thinking that it looks like we're only analyzing one health assessment documented at a specific point in time. But I do want to emphasize that our platform is also designed to work asynchronously. So we can aggregate data from multiple health assessments over a period of time to identify possible infections to make sure that we're not missing anything important. So at this point, I'm going to show you how clinicians will interact with our platform. And that's through a browser extension. So I'm trying to point it out in the upper right-hand corner. There's a little icon there. If I click on that, that's going to launch our platform. So you can see here that I have a patient overview. And so we have identified a possible infection in this patient. You can see that we have a possible UTI episode here. We also do have a general overview that's going to be more of a facility level overview or a bird's eye view of all of the active infections that are taking place in your facilities. So this is going to be a great way for your infection preventionists, your nurses, your providers to keep track of infections at the whole facility. So now I'm going to walk through the steps of basically confirming this episode and kick off the whole clinical workflow. And I want you to think of the next few screens as an at-the-elbow, step-by-step wizard that's supporting your infection preventionists and providers in real time, 24/7. So we're not replacing their clinical decision-making capacity, but we're putting evidence-based practice recommendations at their fingertips and taking the guesswork out of their process. So the next few steps that I'm going to walk through demonstrate the efficiency of it. It should only take a few minutes to complete all these steps. So first of all, I'm going to go ahead and confirm this episode. So I can click confirm here. I can see an episode summary that calls out the different symptoms that are NLP identified in the documentation. The provider or clinician would then be asked to select the appropriate diagnosis. So I'm going to go ahead and select the acute cystitis without hematuria code here. And then it's also going to ask some additional questions to help us make the best recommendations for antibiotics for this patient. So depending on the data that we can access and pull out of your EMR, we can auto-populate the responses to these questions. Alternatively, if your facility chooses to partner with BASE10, we'll also be able to analyze lab result data over time and develop antibiograms specific to your facility and incorporate them into our solution. But for today, the purposes of today's demo, I'm going to go ahead and answer these questions. So I'm going to go ahead and click sign. And we're basically going to be taken to the next step in this wizard. So basically, our platform is now going to recommend the appropriate lab orders for this patient. Today, we are recommending a urine multiplex PCR as an alternative to the more traditional urine culture. So if your facility chooses to partner with BASE10 for this urine multiplex test, your facilities would have the added benefit of automation throughout the process, including the lab ordering process and the result review and sign off. If your facility chooses to continue working with an existing lab, your clinicians would utilize their current process. So we wouldn't be adding any steps. Luckily, even if you do work with an external lab vendor, we will have the capability to ingest those lab results, either by pulling the data directly out of your EHR or through direct integration with your lab to provide updated antibiotic recommendations based on those results. So I am going to go ahead and sign off on my order here. And the system's going to take me to the next step in our wizard. Once I click confirm and sign here, the system is going to recommend antibiotics to us. And our system is taking into account a variety of factors to make these recommendations. So first of all, it's taking into account the type of UTI episode that we have, whether it's an uncomplicated UTI, a complicated UTI, or a pyelonephritis, since we're basically going to be suggesting a different regimen depending on the episode type. We also do take into account the patient's documented allergies. We also take into account their kidney function. So as long as we have a recent serum creatinine result in the system, we can utilize that information to make the best recommendations for the patient. So for this demo, I'm going to go ahead and pick the Augmentin as our initial antibiotic, and I'm going to sign off on that order. So because of our integration with the EHR, we can actually pass that order directly into the EHR. So you can see we do have an order here. And the goal for us is to basically send all of the required info into your system so that the provider or clinician doesn't really have to add or manually document any of these fields. We will pass all of the information directly into the EHR so that all they have to do is review and make sure that everything in this order is accurate and then activate the order in their EHR. So everything looks good to me here, so I'm going to go ahead and activate this order. So the next step in this process is that basically we're going to fast forward a couple of days in the future when the lab results come back, and we'll have some results to review. So let's see what we find. So I'm going to go ahead and launch my extension. And we can see that we have some lab results available for review here. So let's see what we have. So we do take into account McGeer criteria to evaluate these lab results and confirm whether or not we have a true infection. So in this case, you can see that E. coli is the pathogen that's causing this infection. And we did identify some antibiotic resistances, in this case, extended spectrum beta-lactamase resistances. You may recall that we did select Augmentin, so we're going to need to change the antibiotic at this point. And our therapeutic CDS algorithm would basically identify that and recommend a new therapeutic order in this case. Conversely, if McGeer criteria is not met, and therefore we have no infection, our therapeutic CDS would recommend discontinuation of the antibiotic at that time. So I'm going to go ahead and click OK here and sign off on these lab results so that I can see the updated recommendations for the antibiotic. So in this case, based on all the data that we've collected, Macrobid is going to be the best recommendation, and we have some alternatives as well. So as the clinician, I can go ahead and select the Macrobid order and sign it, and that would be passed over into PCC again. So now we'll fast forward several days in the future after we've confirmed that all of the patient's symptoms have resolved and they've completed the full course of antibiotic treatment. The clinician would then have the ability to go ahead and resolve this episode. So I'm just going to resolve this. And that's basically our infectious disease management solution for one infection from beginning to end. And now that we've, yep.
So I just want to point out to the audience that a lot of what you're seeing, you probably, especially if you use PCC, you're like, well, this is not very different from what we're really doing PCC, and that's exactly the point. We're not trying to ask your nurse or you as the infection preventionist to change what you do. You can see that the software is actually just working in the background, collecting all the information that your staff is putting in, and basically identifying for you, notifying you if there's a UTI or a flu or a RSV infection or pneumonia versus a COVID infection. And then it's recommending what's next in terms of testing to confirm that or medications to give, right? So we know that as human beings, we can't keep up with every single bacteria and every single virus in terms of what's the best treatment or the best test for it, or what are new regulatory guidelines like COVID did during the pandemic where it kept changing. Can't keep up with that, but the software does. So imagine if you're calling the medical director or you're asking the provider to do something, instead of calling and saying, I think we have a fever going on, what do you want me to do? The software is actually already be able to pull as much information as possible. So you can actually say, hey, Dr. Fang, I think Mrs. Jones may be having fevers and some other symptoms that may be from a urinary tract infection versus say COVID, right? Or the opposite, COVID versus say her wound. And looks like we have some recommendations to do this test, and can I get an antibiotic order for this? Instead of saying, can I get an antibiotic? And that's where the doctor may give you whatever his bias may be, right? This is where the software actually say, as you saw Allison show, this antibiotic specifically for Mrs. Jones and this antibiotic specifically for Mr. Smith. So that way you have very patient-specific guidelines that you can go over with the provider to see if they want to give you the order for. But it's much, much different than, it's real, like what we keep saying, it's like your elbow side, real-time clinical pathway recommendations that are personalized to every single case of patient. And it is constantly active. Even while you're sleeping, it's detecting cases to show you as soon as you're back in the system. Sorry about that, Allison, I appreciate it.
Yep, thanks for jumping in. So I guess the next step in this whole process is we do want to pull all of this together for you and illustrate our reporting capabilities across our entire infectious disease management solution, including COVID, flu A and B, RSV, and UTIs. So I'm going to hand things off to my colleague, Matt. So I'm going to stop sharing and let him share. Looks like here it is.
Mary, if you want, you can jump to the next slide, and then I'll quickly go through my demo once I'm done. Perfect, thanks, Mary. So one of the things I wanted to point out, I know we have a lot of IPs, a lot of frontline workers, boots on the ground, on the phone. And, you know, one of the things that we've always heard from facilities, even prior to COVID, but it really got amped up during COVID, was facility efficiencies, right? How efficient can we be? How do we integrate with a facility without just being one other thing for a facility to do, right? Because that's the last thing we want to be. We don't want to be one more thing for you to do on a daily basis. So through automation of regulatory reporting and integration, we allow for the minimal development and operational management at the facility. Next slide, Mary. So first and foremost, there's three different types of reporting. The first one I wanted to touch on is state and county regulatory reporting. So our reporting team at BASE10 is clinician-led. And the way that we get all your data is we've learned a myriad of different ways to pull data, right? I think it's easy to say, oh, well, we just integrate with your EMR. Well, yeah, well, what if not all of my data goes into the EMR? What if I'm tracking it manually? Well, we can set up a data feed. Well, what if it's on an Excel sheet? Bottom line is BASE10 can integrate with any facility and how they track their data. And we pull that data from you automatically. It's not like you have to send us something every day. We do that for you. Once we have the data, we run it through a QA process to ensure submission and accuracy. And then we have routine regulatory scoping to ensure that our processes are up to date. So a great example is several states over the last few months, I think since April really, have gone from requiring reporting COVID all results to just reporting positives, right? And when there's changes in regulations like that, it's no longer on your facility to track those. BASE10 will track those regulations for you. We'll implement those updated regulations, and we'll make sure that your data is being reported to the proper agencies in the correct protocol. And we have regular reporting cadences for state and county. We report daily for all your facilities when it comes to COVID, and then we'll touch on, a lot of people say this is a 4-letter word nowadays with all the changes that have happened since June of last year, but we'll touch on NHSN as well. But sticking with state and county regulatory reporting, if you could just jump to the next slide, Mary. So this is just a visualization of states that manually require manual reporting versus states that have electronic lab reporting, ELR, right? So we all know with a PCR COVID test, the state will automatically the lab will automatically report that result to the state for you. Most of us are doing antigen right now, and that's where we see a lot of time spent, especially in the states where there's manual reporting requirements to get all of those results reported. So regardless of whether or not your state is ELR or manual reporting, first of all, we'll track the changes to that protocol. If a state goes from manual to ELR, we'll track that for you. And then we'll do all types of reporting for you daily. So whether it's electronic, which is a little bit less of a lift, or manual, where there's a lot more lift on a daily basis to get all those antigen results, either all results or positive only, depending upon the state reported, we'll take that over for you as well. Next slide. And this is just a visualization. I won't spend too much time on it, but tracking which states have moved from all results to positive only, and where they're at with manual versus ELR. Next slide. So this is the exciting one, right? This is what we start talking about, and whoever's doing the reporting within the facility, whether it's the IPs, the DONs, admins, this is where everybody takes a deep breath, right? So since June of last year, facilities have been required on the COVID side to report on, at the time it started, it was about 6 different forms. That's been whittled down to about 5, but it's still a significant lift from a manual perspective to do all of that tracking and then to report on it on a weekly basis. So again, through integration, or however we have to get that data, we pull all that data that needs to be reported, from testing results to vaccination statuses, and we report for you on a regular basis. You essentially confer your rights to BASE10, so you no longer have to worry about reporting on a weekly basis. We make sure that you never miss a deadline. We report every Friday. Every Thursday, you'll get a report to show which percentage your facility is at as far as completing those 5 forms. And again, we have internal QA processes to ensure that reporting accuracy. So it really lifts that manual burden to track and then manually submit. And facilities could be submitting different ways, right? But to manually submit through NHSN. And I wanted to kind of give you a peek behind the scenes as to what the NHSN reporting looks like and how we automate those forms for you. So Mary, if you wouldn't mind, could I share my screen? Thank you kindly. So this is what NHSN reporting looks like in the BASE10 portal. Right across the left to right, what you can see is the name of the report. I'm sure a lot of you are familiar, and I should mention that this is a test environment, right? So all of this data is test data. There's no PHI in here. So left to right, you have the name of the report, the name of your facility, the date that that form is due, the status of the report, so we know that it's in progress and you'll have to be done the form by this Friday, and which percentage you're at completing the form. So I want to give you a little bit peek behind the scenes as to how we track this data for you automatically. So normally when you're looking at these forms on NHSN, you're used to, again, manually tracking, but also all of these fields having to be manually populated. Whenever you see a white box here, that means that that's still a field that, dependent upon our integration capabilities, we may or may not ask you to manually input. But for right now, for the demonstration purposes, these three fields would be fields that the facilities would go in and fill out themselves. When you see a gray field and then that little do not enter sign, right? That's data that we pull out automatically from your facilities and automatically populate to this form. So we ask you to fill out all beds. That should be fairly easy. That number normally doesn't ever change. Your current census, so total number of beds that are occupied. Admission, so the number of residents who are admitted or readmitted, and they continue to require transmission-based precautions. And then everything else on here, from the number of positive tests that week to the vaccination status of those positive patients, and or this is the RIF form, so patients, residents, we automatically populate for you. So essentially what we do is, we've heard, dependent upon, again, how a facility tracks and does their reporting, anywhere from 10 to 15 hours a week spent on NHSN reporting, we whittle that down to about 15 to 30 minutes that facilities spend on all 5 forms throughout the entire week. So huge time savings, and we'll kind of touch on the savings when I show you the operational level reporting. But a huge lift to the facilities where we rarely track all of this data. And again, I know a lot of you are probably asking, well, you know, when you get to the staff vaccination summary, there's so many different groupings of staff, from students to licensed practitioners, and we don't necessarily track that in like an UltiPro type of system for our staff. Again, we can work with any source data and make sure that we automatically populate these forms for you. Okay. So that's just a peek behind the scenes with NHSN. Wanted to show you our operational level reporting. So if you had access to a facility or facilities, we would be able to provide you this level of reporting to give you a bird's eye view of that data that Allison was mentioning previously. So when you look at this, there's a couple things I want to point out to you. One, all of this data is exportable. So if you just hover over this, you can click on this and export everything to CSV. So all of the data in this dashboard is exportable. That's the first thing I want to point out. Across the top, you have 3 different tabs. So you have clinical, you have detailed, and then you have program indicators. I want to touch on the clinical side first. On all of these tabs, you will have certain filters. So you can filter by the date that the test was collected, the name of the facility that you want to look at. Sometimes facility region is important, right? A lot of different facilities have groupings of certain facilities in a specific region, so we can customize the report to include regions. You can view by patient type. So if I just wanted to look at respiratory infections for my residents and kind of take out the nursing home visitors, employees, vendors, right? I can do that by just selecting the residents and to see what the overall data is for just residents. But right now we're selected to all. Same thing for infection, right? If I want to look at respiratory infections, which again is going to pull in influenza A and B, COVID, and RSV or UTIs, I can do that by selecting this filter. But right now you're looking at all of the data again at a high level, right? So number of overall infections, we know that we have 63 or 14% of our infections are UTI. And then we have 400 or 86% of our infections are respiratory infections. And again, we can dive into this data to see how, of those respiratory infections, how many are COVID, influenza A and B, and RSV. Number of positive test results since the beginning of the year, and you can kind of look at those infections over a specific time. Again, for both respiratory and urinary tract, if we changed it to just respiratory, you would only see respiratory. Number of negative test results, days to receive test results. So this is important for BASE10 because we actually have our own lab, and we want to show you how long it's taking for you to get your test results, right? And you can pull that data down here. Hospitalization rate, that's an important percentage for us as we get into our program indicators tab, and then readmission rate. You have a detailed tab where again you can dive into some specific numbers where it'll break down those infection types for you overall. So if you wanted to look at your positivity rate by infection for your nursing home residents and your nursing home employees, you can do that at a high level here on this tab. Total recovered cases, total negative cases, number of tests completed by a month, and then a breakdown of that by infection, and then active cases within the last 10 days. This next slide is really cool. So what BASE10 does with our IDM solution is we will partner with you and we will say, okay, we're going to look at your data over the last year and we're going to create a baseline. We're going to create a baseline for one, the number of full-time employees you have, the number of that you spend on medication specific to these infections, and then hospitalization reduction, right? So we want to look at the percentage of the number of hospitalizations that you have over the year. And then we say, okay, well, our starting point is this, and BASE10 doesn't make any money until we reach certain levels. So this is saying that since we implemented with this test facility, we've reduced their overall FTE need by 18%. We've reduced their medication spend, again, on the specific medications that are specific to the infections that we're looking at here, by 20%. And we've lowered their hospitalization rate by 6.3%. So this is a great way, and again, the filters to look at facility-specific things and infection-specific things as well. But this is really a great visualization for you to say, how is the BASE10 solution working for me, right? And again, the one thing I want to leave you with before I jump off of this is all of this reporting is customizable. So if you say, Matt, I want to see something added to this, we can definitely work on that for you as well. So I will stop sharing and I will hand it back to Dr. Feng. I think you're on mute, Dr. Feng.
Sorry, that was on mute. That kind of concludes our presentation here. So hopefully you can see that there is a way to use the data that your staff is already doing and collecting on a daily basis and connecting it in an elegant way so that you can save on time and save on some of the reporting or other types of KPIs that you're trying to achieve. So we're happy to pause here and turn it back to the Mountain Pacific team to see, and the audience to see if there's any questions.
Thank you, Dr. Feng. Let's see if we have anything in the chat box. It looks like there was a question, but that's already been addressed. So thank you. We appreciate your time today, Dr. Feng, from you and your team. And we will post this to our website as well as send this out to our listserv next week. So if you have any questions or follow-up comments for Dr. Feng or his team, you'll have access to that. Well, we thank you for taking time to join us today and look forward to seeing you next week. Be well, everybody.
Thank
Thank you.
you.
Thank you very much.
Bye-bye.